Sleep apnea is a disorder and it's characterized by disruptions in the normal breathing during sleep. These breathing interruptions often cause sleep disturbances throughout the night, including frequent waking and snoring. Sleep apnea is associated with an increased risk of hypertension, heart disease, diabetes, poor cognitive function, and many other health concerns. Effective sleep apnea treatments are available, and they can greatly improve the quality of life. But many people either don't seek the treatment or give up too quickly due to the inconvenience or the discomfort. It's important to work with a qualified sleep specialist to find the right solution. Sleep apnea is an increasingly common but underdiagnosed disorder, and it's characterized by repeated interruptions in the normal breathing during sleep. It's associated with an increased risk of several serious health problems. These include hypertension, cardiovascular disease, type 2 diabetes, cancer, gout, cognitive dysfunction, autoimmune disorders, and pregnancy complications. Fortunately, effective treatment options are available for sleep apnea, and dietary and lifestyle changes can reduce the severity of the disease. Emerging research also suggests that integrative interventions like antioxidants can improve sleep quality and respiratory function in patients with sleep apnea. Some of the risk factors for developing sleep apnea are being overweight or obese, being male, Asian or Hispanic, having allergies, being of older age, or having anatomical abnormalities in the airway. Some of the signs and symptoms associated with sleep apnea are snoring, gasping, and choking sounds while sleeping, a pause in breathing while sleeping, intermittent waking and insomnia, nocturia, the frequent waking to use the bathroom, daytime sleepiness or fatigue, a dry mouth, sore throat, or headache upon waking up, difficulty concentrating or remembering things, irritability or depression, and sexual dysfunction. Some of the conventional treatments are the Cpap, which is a continuous positive airway pressure, and positive airway pressure variations, oral appliances to help to keep your upper airway open, surgery for when the obstruction is due to an anatomical problem, such as an enlarged tonsil or adenoid, pharmacotherapy, or hypoglossal nerve stimulation. Some of the novel and emerging therapies are acetazolamide, renal denervation, nasal expiratory positive airway pressure therapy, oral negative pressure therapy, and hormone replacement therapy for women. Some dietary and lifestyle changes can be beneficial for sleep apnea, like weight loss, a Mediterranean diet that's low in sodium, exercise, avoiding alcohol, side sleeping, or at least turning the head to help when you sleep on your back, acupuncture, and stopping smoking. Supplementation with the antioxidant N-acetylcysteine has been shown to ameliorate the signs and the symptoms of sleep apnea, including apnea-related arousal, daytime sleepiness, and snoring. Coenzyme Q10 is an antioxidant with beneficial effects on the cardiovascular system and metabolism. It may benefit sleep apnea patients who are at an increased risk of cardiovascular disease, hypertension, and impaired glucose tolerance. Studies have found low vitamin D levels are associated with an increased risk of insulin resistance, diabetes, and metabolic syndrome among patients with obstructive sleep apnea. Sufficient levels of omega-3 fatty acids are associated with a host of cardiovascular and anti-inflammatory benefits, and these can be important for individuals with sleep apnea. Supplementation with B vitamins has been shown to reduce the levels of serum homocysteine, an amino acid that's associated with an increased risk of cardiovascular and neurodegenerative diseases, and it's shown to be elevated in patients with obstructive sleep apnea. Studies involving animal models of sleep apnea and intermittent hypoxia have found probiotics can improve some of the side effects of systemic inflammation in the heart and the brain, as well as hypertension. Sleep apnea is characterized by repeated disruptions in normal breathing during sleep. These frequent respiratory interruptions result in periods of low blood oxygen levels, nervous system dysfunction, and sleep fragmentation. People with sleep apnea often stop breathing periodically, then suddenly gasp for air during sleep. Loud snoring is also common in people with sleep apnea, and it's often reported by the bed partners of those affected. There's two main types of sleep apnea: obstructive and central. Obstructive sleep apnea is much more common, and it's associated with an increased risk of several major health problems and greater mortality risk. Epidemiological studies have historically estimated the prevalence of obstructive sleep apnea to be around 3% to 7% in men and 2% to 5% in women, but it's believed to be vastly underdiagnosed. The National Healthy Sleep Awareness Project estimates at least 25 million adults in the US are living with obstructive sleep apnea. Obstructive sleep apnea can lead to several health concerns as a result of chronic sleep deprivation, daytime sleepiness, cognitive difficulties, depression, and an increased risk of accidents and injuries. In addition, a significant growing list of serious chronic diseases has been associated with sleep apnea, including cardiovascular and neurological diseases, obesity, polycystic ovary syndrome, and insulin resistance and type 2 diabetes. The first-line treatment approach for obstructive sleep apnea is a device that provides continuous positive airway pressure, known as a Cpap. This device is worn during sleep, and it introduces mildly pressurized air into the airways to keep them open. Cpap therapy can be cumbersome and uncomfortable, so recommendations for Cpap are generally reserved for patients who experience excessive daytime sleepiness, those with comorbid hypertension, and those with whom the sleep disruption affects the quality of life. Research suggests the Cpap can improve blood pressure and cognitive function for those with sleep apnea. Some patients are unable to tolerate the Cpap, in which case other therapies can be considered. Dental devices and surgical procedures to open the airway can be beneficial in some people with sleep apnea. Other methods sometimes recommended include variations of positive airway pressure and negative pressure devices. Dietary and lifestyle interventions can have a significant impact on the severity and the consequences of sleep apnea. Weight loss is the most common and well-supported adjunct to Cpap, and it can provide additional benefits by reducing inflammation. Exercise, a lateral sleep position, avoiding alcohol and sedatives, and a general healthy diet can help to manage the symptoms and the severity of sleep apnea. Integrative interventions can both reduce the severity of sleep apnea and can help to minimize the consequences of some of the serious conditions associated with it. For more on sleep apnea or on herbs, supplements, and health conditions, check out my website.